A warm welcome to everybody and thank you for joining us. My name is John Copps and I'm from Mutual Ventures, and I'm really looking forward to today's discussion, which is addressing a topic that I know is at the top of many of your in trays, which is producing your local Get Britain Working plans. So Get Britain Working is the government's call to action to address unemployment and a range of underlying issues in the labour market around ill health, skills and the quality of work. As we know, every area led by combined authorities where they exist, or groups or individual local authorities where they do not, have been asked to produce their own local Get Britain Working plans. Last month, the DWP published guidance on what it expects from these plans and when. I'm delighted to be joined by three guests today to discuss their emerging local plans and how they're approaching the task of creating a unified approach in their areas. And our guests are from a range of different backgrounds and types of local authorities or types of areas, and we will get into a discussion with them. So let me turn to our panelists now, who will introduce themselves. Afternoon, Judy.
Good afternoon. My name is Judy Gibbs. I'm Head of Service for Skills and Employability at Worcestershire County Council.
And good afternoon, Rachel.
Hi everybody, I'm Rachel Parker. I work for Leicestershire and Rutland ICB, and I'm currently leading on the development of the ICB work skills and health strategy, and obviously liaising also on the Get Britain Working plan. Hello.
And hi, Nick.
Hi, thanks, John. So I'm Nick Whippendowd. I'm an Assistant Director for Education, Work and Skills for Greater Manchester Combined Authority, with the focus on adult skills and employment support. So in our city region, the Get Britain Working, the local Get Britain Working plan falls under my remit.
Well, it's brilliant to have you, all three of you. And so our speakers are here to give their views, but I think I can speak to them to say that they're approaching this with a sense of humility and a realisation of what works in Greater Manchester, what works in Leicester, Leicestershire and Rutland, or in Worcestershire might not work in your area. So we're not here to give advice as such. We're here for a discussion to share experience and hopefully give you some ideas and put you in a better position to write your own plan. So in that spirit, we'd also really like to hear from you at the same time. So there's an on-screen Q&A facility for you to ask any questions you have and leave your name if you wish, and we'll try to get to as many of those as possible. And I'll also send out a link to the copy of this recording afterwards. So before we start, I just wanted to give a very quick
Frozen, John.
Never great when the host has the technical problems, is it?
That's not helpful at all, is it?
Can you hear me?
Yes, can now.
Yeah, apologies. So I'm going to give apologies. Hopefully that won't happen again. So I'm going to give a quick canter through what is in the DWP guidance, just for everyone's very quick benefit. And so really it talks about creating a plan for your local area, bringing everybody together to cover work, health and skills and issues in the labour market, particularly those around what the DWP call economic activity and towards their overall target of this government's target of 80% employment. So what does the guidance say? It says your plans must be whole system. They must have a unified understanding of the immediate goals and long-term priorities across your partnership, with that partnership governance underpinning it. It must fit with existing strategies and plans, including the work done with ICBs around work and health plans, which we'll get to. It should be data-driven and outcome-focused, and the DWP published a series of outcome metrics that you may well have seen. And I can share a dashboard after this that presents some of those at local level. it says there's no set format, but some core elements are expected. And maybe we'll get into some of that discussion today about what should be in there or what might be in there for each area. And it can reflect the maturity of each area. So not everyone will, in other words, not every plan will look the same. And the timetables are short. So a plan is requested for July. And the guidance also says at a minimum, areas are expected to have initial plan, particularly in addressing the health-related economic activity area by September. So what does that mean? It means a well-structured plan with a clear set of objectives and priorities, and buy-in across your partnership that will stand you in good stead and build those relationships to deliver over time. So that's the kind of context. And so let's get straight into the discussion now with our colleagues. And so to start us off, to kick us off, perhaps I could start with you, Nick, to give us a brief sense of how you've started by approaching the plan and kind of where you started from.
Yeah, sure. So I think I'll start by saying I think we're very lucky in Greater Manchester. Obviously, we're a combined authority. We have our 10 local authorities that are equal partners in that public sector space. We have coterminous boundaries with our Job Centre Plus offices and also with our ICB. So we geographically are in a really good place and have worked together collaboratively for a number of years, really since the combined authority was formed. We also have been working in the work and health space for a long time. We've had devolved work and health programme. We've had a number of other different programmes that have joined up employment support and health related barriers, and that through our Working Well programmes, and that really has given us some great foundations, which is why I'm saying we're lucky, because we've got that history. We're not coming at this cold. And I think more broadly, our approach is we know our direction of travel. We know strategically where we're trying to get to, because those conversations have evolved over time. For me, what the plan is allowing us to do is set those down with the shared evidence base as a moment in time and give a really clear steer and agreement to all our system partners about what that direction of travel is. So that's our kind of approach. As I say, I keep saying to the team back at base, I think the content is written. It's the engagement that's important for us in this space.
That's great. And we'll get into that discussion about engagement and how people are working with their partners. So Rachel, how about you? What's your starting point in LLR?
I guess our starting point was we are a WorkWell pilot. So the original WorkWell prospectus actually stated the requirement for all ICBs to actually develop I think at the time it was a work and health integrated strategy. The skills element actually wasn't in at that time. And so therefore, we've always had it in our minds that we would need to develop this strategy, and that a WorkWell, if you like, will probably be the golden thread running through that strategy, and that the evaluation of WorkWell would be key to actually developing that strategy. So that kind of came first in terms of a timeline, if you like.
And just for people's benefit, WorkWell is a DWP DHSE program that works with 15 ICB areas and partnerships across the country.
And then, thank you, John. And then obviously the Get Britain Working white paper came out. And then, you know, we read that and we realised it was absolutely relevant to the development of the ICB strategy. And then the Get Britain Working local plan guidance came out, as you've obviously referred to, John. And it was really interesting because we as an ICB didn't really have any formal guidance around the original strategy. And it was actually quite nice in a way for me to read the guidance of the Get Britain Working Plan, because I thought, well, hang on a minute, this could just, relate to the strategy as much as it could Get Britain Working Plan. So from that point onwards, I actually did a comparison of the two, the strategy and the plan and the requirements, and they are so similar. So because we'd already developed a stakeholder group, when we did the original WorkWell bid, we had a wide partnership group, including local authorities. So we'd already made those connections. So we then reached out to Leicester City Council, who are the accountable lead for developing the Get Britain Working Plan, and said, can we work together on this, or what do you think? So just to finish that section just by saying there's very strong support in LLR currently to actually just have one plan. So to actually develop them in tandem and just to have one document. So that's kind of where we are right now.
Yeah, that's helpful. And I think the guidance actually says that as well. If there's a coterminosity, you've got the option of doing one plan. Judy, so you're in Worcestershire, which is a single local authority.
Yeah,
How are
a
you?
single
Where's your
local
starting
authority,
point?
one upper tier, 6 districts, and a integrated care board. But the difference being that our ICB is not just Worcestershire, it's also Herefordshire and Worcestershire, which brings a slightly different dynamic. So whilst I'm responsible for writing the Get Britain, Get Worcestershire working plan, I also work in the ICB. So my role in the ICB, which I commenced last September, was to support them with the development of their health and work plan. So I suppose, that's useful, but I'd like to write one like Rachel. However, I have the added dynamic of Herefordshire from my ICB role, and Herefordshire from a Get Britain working perspective sits in the Marches geography, where the accountable body is Shropshire. There's a slightly different challenge there for us. I think my starting point with this was probably WorkWell, but actually, like Nick said, she said the content's written. I would say I'm not sure the content's completely written, but it is known for Worcestershire. And actually, I think we probably did write a lot of the content, because I don't think it changes that significantly from when we wrote our skills action plan under our local enterprise partnership in 2021 and refreshed in 22. So I think some of it is in there. I think for us, what it gives is a really good mandate to get all of the partners around the table, to agree a strategy and to move forward with those priorities. From a sort of practical perspective, I would say that my starting point was probably doing that data analysis, and that's something that we are in the midst of. Worcestershire itself already has over 80% employment. So again, that's a slightly different dynamic than other areas, because we're already over and above the government's ask. So we need to kind of almost go back a little bit and decide actually what do we want to achieve, and we need to agree on that. But I suppose we've also commenced our stakeholder engagement and kind of our thinking through what are we going to do there. And what I would call my internal council engagement, which again, I would say at this point has some challenges, because we've just been through local elections and we have not yet got a cabinet, because we are in a no overall control situation. So that will add some complexity to this as well.
Yeah, challenges. So let's talk about the partnership then. And so, Nick, to your point about the content is written, but sorry, the content is known. I actually think, well, people will be in different, on this audience will be in different positions on that. But let's talk about the engagement and who's been involved. How have you approached that, and what are you doing to achieve what the plan guidance called the unified approach between stakeholders?
Sure. So just to reiterate what others are saying, we're only writing one plan. It's a joint shared plan that will cover, because of our geography, we're able to do that. We're taking our engagement quite far and wide, actually, but we're utilising a lot of our existing mechanisms. So we have a semi-formal joint working arrangement with our ICB and JCP, who meet regularly. So it forms a sort of a governance and oversight, which is obviously required for the plan from those sort of three different organisations. We have a really strong network of our work and skills leads in local authorities, but also our public health, population health leads in the local authorities. So we're using those routes as a sort of secondary sign-off and understanding as sort of an expert group. We also have a work and skills related panel, so they are providing a steer. So that's wider than just the public sector. That brings in the voluntary sector and some of the provider bodies. But the team have been able to utilise things like our independent training provider network, our FE colleges group, lots of our employer networks through our local chamber and our local business growth hub. And to really just gather as many different viewpoints. We've been to voluntary sector networks, because in Greater Manchester, there's our Mayor's manifesto commitments found Live Well, which is services delivered in place, utilising the expertise and the experience of the voluntary sector. So we've been talking to all those different networks. I think probably flippant when I said the content was written, and I'll probably be told off for that by the person that's writing the content. But I think the strategic direction. So that, you know, we had the evidence base from things like our economic inactivity trailblazer bid, from the Work Well bids previously. That was there, and we're just enhancing it. We know the direction of travel because of the conversations we're having with government around the next phases of devolution. And what we're having to do is get that system-wide agreement on what those strategic actions are, what the strategic objectives and the themes within that, recognising I'm very jealous of your more than 80% employment rate, Judy, because we're at just over 70%. So we've got quite a journey to go on, but recognising that there are many different factors that contribute to that, and what is in our gift to change and what isn't in our gift to do anything about, because they're wider societal and economic factors, really.
Judy, what are you doing to get that unified approach?
So you know, we have obviously a really different dynamic to Nick, in terms of I'm writing the health and work plan, and sadly I wish I could write one, but for the reasons I've already said I can't. So I'm writing the health and work, and I'm also writing the Get Britain Working plan. Because of the health and work plan, we've kind of already commenced some of the engagement, because what I would expect to see certainly in Worcestershire is that content is mirrored, but it is more than just the piece that's within the health and work, obviously. So we've started some engagement. We've held stakeholder engagement sessions around the health and work strategy, but we also, similar to Nick, we have a number of forums that we plan to push this through. So we have what would have been our skills advisory panel. We will do a session with them. We will do sessions. So we've already started kind of progressing it through some of the council structures to get some kind of feedback from the various teams where this interacts with. So transport is absolutely one where perhaps some people won't be thinking of having those conversations, but for us, certainly transport is a factor, and we need to kind of understand that dynamic and the dynamic that plays on this agenda. Also having conversations with housing teams and housing officers in the district councils, as well as a number of the ones that Nick mentioned. So we have employability forums that we started on the back of our skills action plan in 2021, coming out of COVID, trying to enhance all the coordination between employment support providers. And we will use those forums to kind of push the messaging out. One of the things I'm most excited about, we have a really good relationship locally, and I think, you know, whilst Worcestershire will be a very different dynamic in many ways, and we'll have a lot of things that I wish that we don't have, sorry, that Greater Manchester will have. What we do have, because of our size, is actually really, really strong relationships. So with DWP particularly, we've got a session that we're holding in a couple of weeks where we will have every Job Centre Plus manager from the offices come to have a conversation with them, because it's all well and good looking at the data, isn't it? But you need to kind of get a sense of underneath it from them, what actually they see on a regular basis, what they feel. And we'll be doing the same with things like social prescriber networks as well. So I just think it's really important to hear the voice in this and not just look at the data.
And Rachel, so you must have good relationships in LLR because you're the ICB, right? And the accountable body is Leicester City, am I right? How are you approaching the partnership?
Yes, that's correct. Well, I mean, we were lucky in a way because, as I was saying earlier, in order to actually put in the bid for the WorkWell pilot, we actually established quite a wide sort of stakeholder group of local authorities, the hospital, community trust, all those people in that group. And so we've kind of had that big partnership group on board, if you like, ever since we put the bid in for WorkWell, and they obviously contributed to WorkWell and supported it. And I actually pulled the whole thing together, but I couldn't obviously have done that without the input of that group. And so therefore, sorry, just to say, so that group, which we call the Design and Delivery Group, which is exactly what it's there to do, reports into an integrated health and work WorkWell steering group, and that steering group reports into the integrated care partnership. So in LLR, we've got an integrated care partnership, which was established quite a few years ago. There's an integrated care strategy. So in some ways, although not specifically to do with the integrated work and health agenda, because that only really came in for us with WorkWell, but prior to that we were well versed in partnership working, and we'd been, even before ICBs were formed, we were very good at partnership working. So what we need to do, because as I say, we've got strong support to develop one document, which would be the ICB strategy and the Get Britain Working Plan. So the governance structure I've just described is great for integrated work and health, and so you could argue, well, we can just kind of adopt that same governance for this document. But obviously the local authorities have got their own governance forums. So in the local authority, there's the Business and Skills Forum, which obviously, and I'm sure other bodies, which I probably don't know about, which form their governance. So we need to be able to kind of merge the governance in order to be able to develop this document. But of course, WorkWell has greatly enhanced as well our communications and with all our partners and consultations, because our WorkWell model is actually based in PCNs in primary care. And therefore we've involved lots of different groups like social prescribers and lots of people from the voluntary sector in relation to the signposting of WorkWell. So I think that side of it is well established, but I don't think we're as far down the line as Nick and Judy in relation to actually consulting on the document, because we don't have a draft document yet, but we do have those mechanisms in place in order to consult on that once we actually put pen to paper. I've actually done all the desktop research, so that's just involved in identifying all the key national and local plans, documents, white papers that this document needs to be in line with. So I've done that bit, and I've started to look in anger at all the data sources that will need to underpin it. So I think we're sort of getting there, maybe not as far ahead as the other two speakers.
So I think what you've all described as the partnership. We had a question in around, so the guidance from DWP talks about representation from the voluntary community sector, and it also talks about employers as well. How are you feeding those in?
So I think in Greater Manchester we're doing that in different ways. I've responded in the question, but so the voluntary sector has a formal role on our work and skills executive group, but we are also we have a number of equality panels, which are representative of different demographic groups that are there to influence and help shape Greater Manchester policy. So there's been a lot of engagement with them, and also working with voluntary sector partners that are involved in the delivery of a lot of the existing activity to help understand some of the barriers that they might be facing, alongside them being representative of the residents' voice, which is actually really, really important in this plan, because we can have the best highfalutin ideas we want, but if it's not going to work on the ground, it's not going to work. So I think that's our approach to the voluntary sector. On the employer side, again, it's working through our Business Growth Hub, our chamber, and the sort of employer networks that we have. We have a massive SME population in Greater Manchester. So yes, we've got some of the big names, but the bulk of our employers are from our SMEs. So I think it's making sure that is represented and actually then reflected in the plan around the role of employers in achieving the 80% employment rate. I think there's very much an ask and offer in this space, because they have to play their part in the government's ambitions and therefore our local ambitions, as well as being given skilled residents or stuff being offered to staff to allow progression. So I think that role of employers is really critical, and that engagement of and with employers has to be two-way, that they have to have an offer and a contribution to make to achieving the plan's objectives, not just be a recipient of the activity.
Mm-hmm. It's tough though, isn't it, employers, Judy, to sort of...
Yeah, it is. I mean, we predominantly, like Nick, have a SME base, but actually most of our organizations are less than 50 employees. So it's really difficult, because obviously it's a lot of businesses to get round and spread the message around. And in terms of some of the priorities that I think we will have, because actually whilst we've got an 80% employment rate, our challenges sit in kind of young people moving into the market, but also that inclusive piece in terms of individuals with health conditions and who are inactive, who've perhaps been off long-term sick, etc. I think those are much harder agendas for our employers to embrace. We work collaboratively with the Growth Hub. They are our kind of local authority voice to business. So we will absolutely do some consultation with them. We have employers that sit on a number of our governance boards anyway. And yeah, we will certainly be talking to them, but it is something that we've, been hearing really strongly of recent times. And it's difficult to, I suppose, think about it in the sense of not just what you're hearing now, but in terms of what's the long-term planning. And I think one of the challenges for us in our county certainly is that because of the makeup of businesses, actually a lot of our businesses just aren't thinking 12 months, 24 months down the line. They're thinking about the here and now. So it's difficult to get some of that voice, because actually they're not having those thoughts themselves at this time. And certainly the current rhetoric that we hear a lot in Worcestershire is just all about the national insurance increase and it not being the best business environment currently, but it's one of the most difficult. Absolutely need to continue to do it, but I don't think there's a unfortunately, I wish I could give you all a winning way of doing it, but I don't think there is one.
Yeah, and there's a comment in the Q&A. I think it's a comment really about how difficult this must be with so many different stakeholders, because I think this agenda from the government point of view started with work and health, and now skills is a big part of it, as it should be. But there's so many different stakeholders. So Rachel, what's the hardest thing in getting everyone to have a unified voice on this?
Oh, gosh, That's a big question. I think well, I can't really speak specifically about employers, simply because I'm not actually the key lead for the Workwell service, although I was involved in the bid. That's actually somebody else is actually leading on that. One of my colleagues is leading on that very well, and he is obviously just starting or has started to engage with employers, including SMEs. So I kind of know that he's doing that, but I'm not really an expert on it. And I know that he's liaising with Chamber of Commerce. In terms of the VCSE, we've got a VCSE alliance in LLR, and we are well connected with them. I think with the VCSE, it's always a balance of funding against the probably increased capacity. So even if you look at things like signposting from the Workwell service into the VCSE sector, then that increases their capacity. So there's always that balance. And I know I'm not answering this very well, but it's probably because I'm not really an expert in that area. But I think in very general terms, I think everybody in almost any organisation is just over capacity at the moment. In other words, they're struggling there, whether it be public sector, VCSE, nobody has enough resource. And so therefore, everybody has to prioritise, I think, within their own organisations. And so therefore, when it comes to partnership working, it may be seen, and I don't know, by some organisations, is well, we're being asked to do a certain thing as because we're part of this partnership, but in actual fact, it conflicts with, or we don't have enough capacity to do what we as an organisation need to do. So I think that there is always that slight dynamic going on there.
Taking that sort of broad view of prioritisation, I think we'd all agree there's uncertainty around as there has been for quite a long time, particularly in the public sector. And the plans ask for short-term goals and longer term ambitions. How hard is it
Sorry, you're fading off again, John.
Medium term ambition, long term, because there's so much uncertainty around? Maybe one for
Sorry,
Nick.
John, we kind of missed a lot of what you said. You were sort of fading off again, but you were asking about short-term goals and longer-term ambitions.
Yeah, so the plan asks for short-term goals and long-term ambitions, but we're in a situation of considerable uncertainty, particularly in the public finances. So I'm just wondering how you reach those longer-term kind of objectives, if you like, in that context. So maybe that's a question for Nick.
Thank you. So yeah, I think in some ways we are fairly clear on our long-term goals in Greater Manchester, and that's about an integrated system that isn't siloed and isn't constricted by short-term programme funding with limited eligibility, whether that's commissioned locally or nationally. I think it's about people at every stage of their employment journey, whether they're furthest away from the labour market, whether those are young people trying to work through what careers they might have, or their direction of travel, whether that's our long-term unemployed or our economically inactive, whether that's our recently unemployed, and whether it's actually people in work that are wanting to progress in work or just want to stay in work and are facing, for example, health challenges or caring responsibilities that is making it more and more challenging for them. So I think we know that we want to sort of create a series of pathways that picks people up wherever they are in that journey. And we know that as well as removing almost artificial barriers from different siloed programs of activity, that we want to take that much broader and make sure that the wraparound support that people have to remove their barriers, whether that's housing related, debt related, health related, a lot of those sort of societal factors, I suppose, that can impact on someone's ability to work one way or another. That the wraparound is there, and that's very much at the heart of our Live Well model. But it's all the way through to that growth agenda and recognising the big investment zone work that's going on, the economic growth areas, the sort of hotspots, I suppose, across the city region, and saying, well, what do we need there? What are the skills of those businesses that haven't arrived yet, that, you know, and 10 years in the future? So I think we know what the ambition is to get that system right and in place. I think we kind of know where we're at now, because we're doing a lot through our Trailblazer, which is about shaping that system and building capacity and infrastructure in place, so in a local area. And we've got the history and experience of devolved adult skills. I've got the grey hairs for all of this to prove it, and the devolved some of the devolved employment support activity. So I think for me, we know what the short term, we know what we're trying to achieve in the next 18 months. We know what the big goal is. And obviously it's also the increased employment rate. I think it's the middle bit that's actually the challenge. It's some of those trickier things that involve multiple stakeholders, multiple government departments that will need that shift. And I think that's where, you know, we might see the problems. I mean, as I'm sure everyone else is, we keep talking about things like fit notes at the moment, and how could that system better support people on their journey back to work, but recognizing the huge challenges around capacity of GPs and their expertise in medicine and general practice, not in support back to work. So I think what we will end up doing is this is the piece of work, this is the engagement that's going on at the moment, but we will end up identifying some of those really gnarly problems and which ones will have the biggest impact for us, and start wanting to kind of put structures, subgroups, call them whatever you want, but in place to try and tackle and break down some of those, as I say, actually systemic barriers that are restricting people's potential, I think, ultimately.
Interesting that it's that middle bit, as you said, those gnarly problems like FitNote, and of course there's been FitNote reform's been talked about for quite a long time, hasn't it? But I wonder how much that needs to be done locally and how much nationally, but interesting.
I think there's both, and there's an opportunity to demonstrate and pilot locally that can influence national, is what I would say.
Yeah,
I was just thinking, because obviously in LLR, because the WorkWell pilot is actually based in primary care, that's exactly the model we've got, which is that the GPs actually refer into the work and health coaches who are fronting WorkWell, and therefore we are effectively piloting that whole sort of process. Yeah.
And
Judy,
Rachel,
would you agree it's those middle bits?
Yeah, absolutely. I was just going to comment on the FitNote piece. It's a really interesting one. We were talking about it, myself and my colleague Amelia, this morning, because actually we're potentially looking to, perhaps with one of our primary care networks, do a bit of a pilot on something different, because actually, whilst I think, yes, WorkWell is a pilot for FitNotes, one of the challenges, I would have said earlier, is language. And I think, you know, the real challenge for everybody going into Great Britain working and all of these conversations is that process before, and sitting down and thinking, yes, we've got to do this from our perspective. We understand why we have to do it, but why does an employer need to get involved? What's in it for them? Why does a GP need to get involved? What's in it for them? What are the gains? And also what I would say is, just because you think that's a gain for them, believe me, quite often it isn't. So the fit notes is a really good example where, you know, in my head, it's a case of, why wouldn't you want to refer people on to WorkWell when you've got a fit note? Because actually that's going to be really beneficial to you because it's going to reduce your waiting list. Well, actually, that's my thought process, but I don't necessarily think it's always their process, because they are plagued with capacity issues, which again, we talked about earlier. In terms of the medium ground, yes, I agree. I think short term, if you're not doing it now in a county type of geography, in these smaller geographies, then to be honest, you're not going to do it. So those are your short terms. They're what you're doing now. They're the ambitions that you have from the programs that you're delivering today or that are taking place in your county. I think for us, you know, the very different perspective from a non-devolved area is that medium term is probably about those relationships actually, and it's about getting everyone to a place where this is a really important and ambitious agenda to them. I think that's part of our medium term. And then for me, actually, I think the long term is about, you know, I haven't got a crystal ball. I don't know how it's going to go. I don't know what local government reform or devolution will bring to Worcestershire, but what I can do is I can be locally ambitious and say, actually, yes, these are the challenges in the system, and this is what I would want. And I talk about it all the time, and I'm sure it's the same in any area. I talk about my jigsaw, and I say, you know, have a jigsaw, and that jigsaw is National Careers Service, WorkWell, Connect to Work, a UK Shared Prosperity, a NEAT programme, a VCS organisation doing this, or Shore Trust delivering one. Restart, whatever the programs might be, but it's a jigsaw that we have to kind of frame for residents. So I think part of our long-term ambition will be to really get that no wrong door approach, and I use the phrase hide the wiring, to hide the wiring for residents, so that actually you find yourself in a situation where you're struggling to maintain work, you can't get into work, or you've fallen out of work, you know where to go. Because I think that's one of the greatest challenges for us in this system, is it's really confusing. People don't know where to go.
Yeah, and I think the jigsaw is a good way of thinking about it. So Nick, in Greater Manchester, part of your jigsaw is the economic inactivity trailblazer, which I know doesn't apply to Rachel and Judy's areas. And then other areas have got the NEAT trailblazers. So how does that feed into this plan?
So I think it's our short-term actions, or at least some of our short-term actions. The approach we're taking with the Trailblazer in Greater Manchester is kind of twin track. We call it double devolution. We've in effect passed the majority of the funding on to our 10 local authorities and have asked them to specify both target audiences, target groups, and testing delivery models. We also have WorkWell in Greater Manchester. We also have some locally funded in work progression. We have we have employment support delivery happening in place, and then we have PanGM integrated stuff. So the Trailblazer is supporting and testing different types of delivery. We're drawing parallels between the different boroughs and seeing what they're doing. And then on the other side, which is more the sort of system-wide approach that we're looking at, and this is where we will learn how we fix those gnarly problems, hopefully. She keeps her fingers crossed. But about, you know, actually, how do we build the capacity in the voluntary sector to increase their readiness to be able to deliver on these agendas? How do we really embed residents' voice across the work? How do we take in a place what might be a integrated employment and skills system, but not a wider integrated, so into a whole integrated public service in place type system? So, you know, so we're testing a lot of that over the next few months for the life of the Trailblazer. But that's all building on our Working Well programs that happen PanGM, our Workwell, it's confusing in Greater Manchester, but the Workwell Vanguard activity and some other locally funded, whether that's through the CA or Greater Manchester, to it's feeding, it's learning, you know, it's growing what we know the whole time. And I think for me, what's brilliant about the Trailblazer is the focus on piloting and innovation. What my concern is it's a 12-month program, and the people that is trying to support are those people that often need a lot more than 12 months support. So I don't know if I've got government colleagues on the call, but I need my pitch in there anyway.
Quite right too. Could I ask colleagues about just because I know people listening will be interested in this. How are you going about actually the process of writing your plan? And you know, share as much as you're comfortable with. Like who's writing it? You know, how broadly, what's it going to look like? You know, do you have a sense of that yet, or is that still in train? Because I know people will be there's people listening here who are going to be holding the pen and would just like a bit of either reassurance or a sense of what others are doing.
I think
Judy,
from
maybe?
the
Go on, Rachel.
LMR, yeah, I think well, as I say, I mean, I was the sort of been the designated lead for the ICB integrated work and health strategy as it was then. And then obviously, you know, it didn't take me long once the Get Britain Working Plan guidance came out, as I said earlier, to kind of twig that, well, hang on, you know, these look very similar. So although we haven't reached a decision, if I'm still leading on it, which I don't know whether, you know, leading would be the right word, but if I am, I would certainly be working extremely closely with my Leicester City Council colleagues who obviously have responsibility for developing the Get Britain Working Plan in order for us to bring the two together. And obviously the data is absolutely crucial. So the data that identifies the needs, gaps in service, all the data we know about public health, all those sources, I mean, that's a huge piece of work in itself. But that exercise is going to be pretty much the same for our strategy and the plan, which will become one document. So I think the really short answer is I think at the moment we don't know in terms of, you know, who's doing what, but what we do know is, or think pretty sure we know, is that there'll be one document and it'll be very closely working together and yeah, just pulling in people, experts where we need them. Yeah.
Judy?
Yeah, I mean, I'd love there to be one document, but there is two. So currently, so I think what the plan's going to look like for us is we're going to do that really deep dive into data and give some insights of what does that look like in the geography. I think we are going to try to look at commonalities across things like, so we were talking about it just the other day, looking at kind of bringing together data around districts and perhaps ward level as well around things like inactivity, NEETs, etc. To have a look at where we have areas where we'd say they're hotspots for NEETs, are they actually hotspots for a number of different dynamics? And I don't think that's necessarily something we've ever looked at on a combined basis. So we are going to do that. I think what we're also going to do in the document is we're going to celebrate what exists and what works really well, because we have some phenomenal programs that I don't think have enough visibility. We're going to celebrate the partnerships that we have as well. So we'll celebrate the work that we're doing jointly to align Workwell and Connect to Work, for example. I think the next section of it will be to consider those, you know, what's the short-term priorities, the mid-term and the long-term. And then I think we'll come up with a very succinct plan on what the next kind of, for us, probably no more than 36 months, because I think, you know, devolution will have moved us forward at that point. But that's what I think it structurally will look like. what I'm going to say as well is I've got the pen, but I've also got the pen for the health and work strategy, and I've got a team, but ultimately I'm responsible for Connect to Work as well. So mine will definitely not be written by July. We've also just had our local government elections. So with that in mind, there's a process it'll have to go through. So I think September is optimistic, but I will go with September for now.
Thanks.
Yeah, so I absolutely hear that. We are aiming to publish in September and take through governance over the summer, but obviously taking things through governance, even when you haven't got the complications of recent local elections, always raises some questions potentially. I think one of the things that we're looking at is making sure there is a flow from we have our Greater Manchester strategy, which is going through a refresh process at the moment. And then there's the local growth plan, or in Greater Manchester, the growth and prevention plan. And we need to make sure that there is a flow through all of that. In terms of content, we haven't got a structure as such yet, but I have suggested it shouldn't be any more than 20 pages long, because no one will read it if it is. And it doesn't need to be detailed, the detailed actions. We can hold that behind, we can manage that. I think it's important that we state the outcomes that we want to achieve, not just the outcomes that were set out in the list that came from DWP. I think they need to be place-based and relevant to the ambitions of that place. I mean, I'm fortunate. I'm not writing the plan. I've got a member of my team and some support that are writing the plan, and a dedicated member of staff at this stage to do that, which is a jointly funded post actually between us and the ICB, although those sits with me. So I think we're in a good place. We're in a tactical place to be able to do that and have sort of feet in both camps kind of thing. But I think the content will be. I love the idea of celebratory, actually, Judy. I think that's really important, because it's too easy to get bogged down into the what's broken and how are we going to fix it, rather than what have we done well. So I think that's a really good takeaway for me, actually, to focus on that, or not focus necessarily, but to make sure that that's part of it. But also it's the gnarly problems. I'll come back to my gnarly problems, but that's where our content and the evidence that says why they're a problem, and the agreement on the actions about how we're going to take those forward.
Yeah, thank you. And so celebrating and gnarly problems. So maybe one thing from you, Judy, one from Rachel, just to sort of leave our audience with something to think about before we end.
Well, I think for me, the absolutely crucial thing is the partnership working and the consultation, and also I suppose I'd factor into that the mapping of services. When we did the Work Well bid, we actually mapped all the employment support services across LLR, and that's absolutely crucial to make sure that there is no duplication of effort. So certainly mapping of services and big, wide partnership working consultation, including the VCSE, I think is absolutely key.
Brilliant.
Mine is localism. I suppose it's a bit of a personal plea of mine, really, in the sense of, one of the reasons that the mayorals have been successful is because actually they have really focused in on their locality. I think it's really easy for geographies that aren't necessarily devolved or that are just starting that journey to kind of almost forget that and look at what some of those other areas have done. This is your chance to be local, to act local, to write a local plan. And whilst I'm not saying don't work with national organisations, don't bring those into your geography, I think that's really an important dynamic of any area. I also think it's a really great opportunity to think about how you locally grow capacity to support your residents. So that would be my one takeaway. Don't forget local, which sounds silly, but I think it's quite easy to do.
It sounds great, I think, and I hope, thank you all, and I hope it's been a helpful discussion for people listening. It's challenged you and it's given you something to think about. And of course, at the centre of it is better employment outcomes for everyone in your area and a better experience for individuals and for families around the country, and growing that inclusive economy that will benefit us all. So yeah, some things have taken away: partnerships, some of those medium-term issues, the concept of a jigsaw, and maybe there's a big ball of wool in your area that needs untangling and then knitting into something that looks like a really coherent plan. But it's bringing partners and it's doing it locally, and it's hearing the voice also of the resident. So our advice and experience is here to make use of. So I'd be delighted to have further conversations with people. I'll send a copy of this webinar around to all colleagues who are on this call, and you can share it with people. And those who haven't been able to attend, I'll send to those as well. We've got some more webinars coming up, so watch this space. There is one in a couple of weeks on the concept of good work and how you can promote good work in your area. So look out for that. So, and as I say, do drop me a line if you want to talk about any of this. So finally, just to say a very big thank you, indebted to our speakers, to Judy, Rachel and Nick. Thanks so much for sharing all your wisdom, and good luck with your plans. And I'll say to everybody else as well, thank you for your time for joining us, and good luck as well.